Basically, falls are very, very common actually, and it's one of the most common causes which actually make a older person disabled, affect their quality of life, affect their independence. So that's why I think falls are significant, because they lose a drastic loss of confidence. In fact, people that have a fall, they can actually have something known as a near fall, or maybe not even fall. So then they get something known as a fear of fall. So whenever they're actually trying to go out, trying to walk, then that fear comes in their mind and they become very tensed about it. And a lot of older adults actually stop going out itself. So that becomes a big jolt for their life. So that's why imagine an older adult not having confidence at all to even stand up and walking and going out, which was normal. So then that's what falls does. So falls dents much more than only the physical part. It actually dents a huge extent the mental aspect as well. I think it's both internal as well as, to be very frank, external. Now, internal factors can be very, very commonly, which we sort of see, which we need to improve anyways. One is vision, because vision decreases, night vision becomes more difficult, depth perception goes. That's why we also tell the older adults that bifocals can be difficult for them, because the reason being that the depth perception, and then it becomes difficult for them to even see the steps sometimes. So that is there. Then second is hearing, lose hearing loss, then losing the balance in hearing. That also leads to dizziness. Dizziness can ultimately lead to falls. So things which are causing vertigo, that is there. Then if they have things like diabetes, because neuropathy of any sort, which is known as which causes diabetes, so that sensation, if it goes in the feet, that also causes them to a great extent to fall. Then we often neglect the footwear. I think the footwear is very important. Sometimes the footwear might not be that comfortable, or it might not be the right one, because I've seen a lot of older adults wearing slippers, but not all their toes are actually inside it, or they are not entirely comfortable. So that is important. Then the type they are walking, their gait. Sometimes their gait could be because of diseases. Maybe there is a past history of a stroke. Maybe there is cerebellar issues. Maybe there is Parkinson's, which, as we know, has a pretty slow gait, difficulty. I mean, the center of gravity is almost lost, so there is a difficulty of fall, especially on the back side or the front side, both. Then foot deformities are another thing which are very important. A lot of older adults might have minor fractures, or they might have minor deformities, maybe in the toes, due to which they might always be a fall risk. So these are certain things which can be internally. Then medications, a lot of medications can lead to falls, especially medications which will cause them to get dehydrated, medications which can actually suddenly drop their blood pressure. Then so certain antihypertensives, yes. Then another thing is lack of fluids. Dehydration can also cause falls. Then very important is orthostatic hypotension, that is, in different positions of an older adult, the BP might be different. So if the systolic and diastolic blood pressure is quite different in both spaces, then it will, there is a huge propensity of them actually having a fall. Then a lot of older adults might have cervical spondylosis also, so that also can lead. Then we always tell older adults to get up from the lying down position or change position very slowly, because sometimes when they do it in a jerk, then also they might get a bit dizzy, or they might, it might actually cause them to fall. Then things like arthritis, knee arthritis, which makes it difficult to walk, hip arthritis, then back pain, low back pain, something like a lumbar canal stenosis. All these things are also some things which can lead them to propensity to fall. Then osteoporosis per se, having a bad bone health, that itself is something which can lead them to actually are at a risk of having fall. Now externally that can be a lot of factors, especially the environment that they live. Too much of clutter in the living room, the distance of the uh, bathroom and the bed is very far, especially in the night time if they have to go. Lack of lights in the pathway, lack of grab rails, handbars, lack of support in the Bathroom, because bathroom, they say home is the safest place to be, not necessary for a fall. The bathroom is one of the most common areas where the fall is, where older adults have been just found overnight, because a lot of times older adults actually even close the doors, so they are told not to do it purely because uh, uh, if they fall, then there have been, we have found people just yelling the entire night, but nobody has heard because they are actually been far off. Then another thing is, the bathroom is usually a mixture of oil, water, and soap, which can be a very dangerous sort of mixture. So that is again, then the height of the toilet. This is also very important, because whenever they have to sit down, when they're actually trying to stand up, whether it's in the Western commode also, it becomes sort of a risk factor for falling. Then things like urinary incontinence, sometimes a lot of older adults just fall in their own urine, so that's why in females and males both, they also should be taken into consideration. So these overview are a lot of causes, lot of them are correctable, lot of them can be taken care of, so by modifying certain home environments. So that's why they say there is no treatment of a fall, you have to prevent a fall. So try to prevent a fall to the maximum, and make your home proof as far as falling of older adults is concerned, because if a fall occurs, then a lot of issues can happen.